It's not ominous.
So I can't actually see the chat and questions if I'm advancing the slides, just to let you know.
Correct.
Okay, just want to be clear. I might log in from my phone just so I can be following things. I'm good. Mm-hmm.
Hi, everybody. We're going to give it about 30 more seconds because people are still streaming into the webinar, and then we're going to get started. Hi, everybody. I am going to do some introductions and some welcomes and get us kicked off tonight. I am Laura Wheeldryer. I am the Executive Director of Maryland Family Network, and I am thrilled that you have joined us this evening. This is the second in MFN's series of presentations around childcare during COVID. We hope that you will also join us on Wednesday evening for the final part of this series when we present EPIC Lessons Learned, what EPIC and EPSA providers can teach us about reopening childcare. There are going to be two sessions for that presentation, one at 4:30 p.m. for childcare centers and one at 7 p.m. for family providers. Registration information about these will be in the chat box on your screen. They're also on the MFN website under events. Each of the presentations in this series strives to strengthen the field of childcare in Maryland. Strengthening the field not only means having enough high-quality childcare providers open for business so that parents can go back to work, it also means that providers themselves have the resources they need to be able to reopen and stay open. Most importantly, it means that Maryland's young children have safe, quality childcare so that they will grow up and become the doctors, nurses, teachers, first responders, and others who will take care of us the next time there is a major crisis. Tonight, we are pleased to welcome to this session 3 presenters that Maryland Family Network has worked with closely in the past on a range of projects. Each are experts in the field of early care and education, and they come to us from the Parent Infant Early Childhood Program within the Institute for Innovation and Implementation at the University of Maryland School of Social Work. I'm only going to say that once. We're very pleased to count the Institute as a partner in our mission, and I'm going to now introduce each of our 3 speakers. So first, let me welcome Margot Candelaria, PhD, who is the co-director of the Parent Infant Early Childhood team overseeing all research and evaluation efforts at the Institute for Innovation and Implementation. If you could advance one slide, that would be great, and they'll see their pictures. One more.
There we go.
There we go. This includes 2 early childhood system of care grants, each of which Maryland Family Network has had major roles in, the Carroll County eSmart Project and the Southern Maryland Bridge Program, and 2 large contracts with MSDE as well as other projects. In this role, Margot focuses on program evaluation and implementation science aimed to improve programs for young children by using data and engaging in CQI processes. She has a long history of conducting research with young children and families at risk, including premature infants, drug-exposed infants, families in poverty, attachment and parenting concerns, and those struggling with early childhood mental health challenges. Dr. Candelaria is also a licensed developmental psychologist with extensive experience with parenting, early childhood mental health, evidence-based interventions, and medically complex children. In addition to her research efforts, she also currently works as the embedded psychologist in the University of Maryland NICU follow-up program. Welcome, Margot. Thanks for being here. Our next presenter is Kate Wasserman. She is the co-director of the Parent, Infant, and Early Childhood Program at Institute for Innovation and Implementation, where she oversees program and policy work for their early childhood projects. She's a licensed mental health clinician with a dedicated focus in infant and early childhood mental health and maternal mental health, with expertise in public health policy, program development, and direct service. She is a current 0 to 3 fellow and a national trainer of the Fussy Baby Network. Kate previously served as lead trainer for Maryland's Race to the Top and Project Launch Workforce Development Grants, training primary care providers, mental health consultants, and home visitors on trauma-informed, family-focused infant mental health competencies throughout the state. Kate holds an MSW from the University of Maryland School of Social Work, where she focused on maternal and child mental health, and a bachelor's in political science from George Washington University. Thanks for being here, Kate. And finally, welcome to Laura Lotta, lead research project coordinator for the Parent Infant Early Childhood Program. Laura previously served as the director of early childhood initiatives at Family League of Baltimore and helped to lead Be More for Healthy Babies, Baltimore's citywide initiative to reduce infant mortality. She holds an MHS degree in behavioral health sciences and health education from Johns Hopkins Bloomberg School of Public Health. Those are our esteemed colleagues joining us tonight. Thank you all so much for being here in what was probably a very busy and tonight very rainy Monday. So now I'm going to turn the discussion over to our guests and to you. I look forward to listening. Thank you so much.
Thank you so much, Laura. So my colleagues and I at the Peak team, intentionally not just called Early Childhood, but Parent, Infant, and Early Childhood Program at the Institute of Innovation and Implementation at the School of Social Work in Baltimore, really focus on supporting the capacity of those like yourselves working across the state within the field and within spaces where young kids and their families already are, to increase your confidence and competence when it comes to addressing behavioral and mental health needs for both parents and young kids. So we have the opportunity through a range of different grants and partnerships, including a very important partnership with MFN, to really come into spaces where childcare providers are, educators are, primary care and other medical clinicians, home visitors, and really support early intervention providers, anyone in the field of young kids, to support them with those evidence-based practices. One project which you'll hear a lot about tonight, and we hope to talk with you about, is really supporting the state's mental health consultation workforce, which goes by many different names, and we'll get to all those in a little bit, but really aimed at supporting you and those that work with in early care and education settings to support and understand the needs of young kids that might act most intensely in your classrooms and in your spaces, to be understood and sort of scaffold and addressed and maintain them in your settings in a positive way. So that's a bit about our work and what we'll talk about. We wanted to take a minute to kind of really orient you guys. Our goal today is not for us to talk at you, but with you, and to really use the Q&A as an opportunity for us to kind of hear what you're going through, what your urgent concerns are, and what your primary concerns are in the context of everything that we're all dealing with right now. And so using the Q&A really actively is what we'll ask for you to do today. And we'll do our best to really be responsive to what's going on. And then the chat is really a little bit more of a logistics place. You can see some of the folks through MFN have already given us a few instructions and given us a few links. And we'll be mindful as well of monitoring both spaces, but really urge you to use the Q&A as if it were sort of more of a live chat discussion tonight, so that we can hear from you and have you guys respond to what's going on. So I get to say this slide, although I have nothing to do with the actual content on it, but MFN, because they are such a thoughtful team, ensured that anyone that participates in the full hour tonight will get credit for your time. As Laura said, this is the the evening of a very long Monday that we know for you guys. So we appreciate everyone dialing in. So you'll get a certificate mailed to you by July 10th with whatever information you registered for if you are on the whole time. And this is the email address on the screen here to reach out to if you have any questions or don't receive that support. And Laura talked about this already as well, but there's another, so this is, among a series of really sort of different conversations all in the same space of childcare and COVID. And so we want to focus tonight really on what this is like for you, what support you guys need, and how we can be proactive in sort of building that into our work. But on the 24th, which is not tomorrow, but the next day, there's going to be 2 different sessions at 4:30 and 7, talking about EPIC and EPSA providers, what we can learn from you guys, as everyone is now scratching their heads trying to determine the rules for reopening and how to do that in a developmentally appropriate and family focused way and workforce appropriate way. So another important part of the conversation to dial into at that point. I'm just trying to be attentive to the chat as we promised to be. So we signed in to the chat for our certificates. I think as long as you're logged in, you'll get them, but certainly sign into the chat so we can hear from you. So a bit about sort of our intention today, and we want to, just be as directive and concrete as we ask adults to be with kids, so that we all have a shared expectation for the next hour. Our intent is to have a conversation for you as childcare providers and early educators to share what's been hard, what might be working, what you need more of or less of, what you're worried about as you're seeing things move and more centers open, and what you need. And for you guys to walk away with some idea of how to address any of those things, and connections, at least, in sort of mutuality from just hearing from peers across your state. Other conversations that have already been held have focused on logistics or finances or those things. Margot and Laura and myself are not experts in any of those pieces. What we are is really focused on supporting the well-being of young kids, which we know is always, always, always going to be focused on the well-being of their adults. And when we say that, we don't just mean their parents or their caregivers or their guardians. You guys as childcare providers are with them so much of the time. And so how you're doing, your stress levels, what you need support to manage in this new space, these new jobs that you guys have, which now encompass many other things, is really what we want to focus on today. So in order to do that, we will have this be as sort of streamlined a conversation as possible. We have a couple of slides just to sort of orient you guys, and we have some polls to hear from you immediately. Everyone's muted to reduce background noise because that's the reality of this tech space that we're in. But please do, comment in the chat, and you'll have our email addresses at the end of this as well. But we hope this is the beginning of a beautiful friendship, as they say in some movies, right?
Okay, so we wanted to start off just getting to know the audience a little, and where you guys are coming from and what you're doing. So we have a poll that we are going to launch, I think. I'm not sure if I have access to the poll, actually. There we go. So if you guys just start off telling us your role, if you're a family child care provider, a child care center teacher or staff, a director, owner, or other. And I do see a couple of you are putting your roles in the chat, which is great, so you guys can know each other. I just want to make sure you're also responding to the poll.
It looks like in the chat, some folks are asking about resending the poll. So it should have just popped up for them, right, Margot?
Yes.
Yeah, the poll did have just one question. We're going through a couple.
We have a couple questions. Sorry. I know we have a moderator here in charge of the poll.
Yes. The poll should have popped up on the screen for everyone. It's not something we sent ahead of time. And you, yes, are only going to see one question at the moment asking you what your role is. And in a few minutes, we'll end polling and then everybody will be able to see the results.
Okay, great. So about half of you are family child care providers, which is great. About 10% staff or teacher, 20% owners, and 20% others. So, okay, that's really helpful to know. I can close that. Okay, great. Lacey's got that. And then we have our second question is if you could just tell us where you're coming from. So what region of the state? Roughly, we break the region down, the state down into regions, but you can see your jurisdiction listed there accordingly.
We'll give you about 10 more seconds and then we'll close this poll and show the results.
Okay, so we have the largest chunk, about 65% of you from Central Maryland, Howard, Montgomery, Prince George's, and then fairly even split between sort of Western, Southern, Northern, and the city. Looks like, I don't see anybody from the Upper Shore. All right, great. So it's a pretty diverse crowd we have going on here. Thank you. So we wanted to also, before we jump into a chat with you about what you needed, wanted to just go over what infant and early childhood mental health consultation is. I think most of you may have heard about this or have used this service in the past. So infant and early childhood mental health consultation can be a lot of things. It's sort of, we think of as a multi-layered options of preventing behavioral health concerns in early childhood settings. So it can be childcare, it doesn't have to be childcare, it can be home visiting and other settings as well. But you have teams of mental health professionals sort of at your disposal to work with families and staff to promote children's social emotional behavior and address challenging behaviors. There's been a lot of research around the benefits of consultation. It can improve children's social skills, reduce distress, prevent preschool suspension and expulsion, improve adult and child relationships, and reduce provider stress, burnout, and turnover, which is particularly relevant now. Just to make sure we're all on the same page, there's some misconceptions sometimes about what consultation is. So it's really an indirect service to kids. You know, most consultants aren't really working directly with children. They're really working with the providers and the adults who work with children. So it's really promoting things and focus on prevention and building the capacity of families and professionals. It's not direct therapy that's happening in your center. It's not always provided in the center, and it's not just training and technical assistance. In our state, the consultation services are offered at the same, often by the same agency as your TTA, but it's usually a different kind of service. And you know, there's a lot of evidence, again, like I said, about preventing preschool suspension and expulsion, improving dyadic relationships, and even having parents reducing their number of missed days at work because they're not getting called about difficult behaviors with their child at childcare. So we won't burden you too much more with some data collection, but we wanted to do another poll just to get some questions and thoughts around your experiences with early childhood mental health consultation. So you can just check all that apply. If you were using consultation services, I should be clear, you might not know it by the name infant early childhood mental health consultation. So depending on your jurisdiction, it might be Project ACT or Chance or Project First Choice or Apples or Early Intervention Project. I know I'm missing some.
Childcare Choices, Lower Shore,
Chesapeake. There's one. So you just let us know if you were using it pre-COVID, if you've been using it during. You would use it if you thought it was tailored to your services, your needs during COVID. You're open and you need the services, but you're just waiting until things to get like return to normal to be able to engage, or you know, you're open but you don't think you need it.
We'll give you about 10 more seconds and then we'll close the poll.
Great. So only about a quarter of you were using it pre, and less than 10% using it during. But about 40% of you would use it if you felt like it was tailored to your needs. Great, because that's the conversation we kind of want to have. Not great that it's not tailored, but great that you would use it. Program is open, kind of waiting. and then currently not in need. Okay, that's great. Really helpful to know. Okay, so there we go. Lana is going to go through just some activities that we've been doing with the consultants to help us learn a little bit more about how to move things forward during this time.
Thanks, Margot. So during this time, since everything closed, we started doing weekly and bi-weekly surveys to the consultation programs to really figure out sort of what sort of innovative things they're doing, what are the challenges to providing services during this time, and then sort of what are the ways that they're sort of innovating and finding ways to support childcare programs during this time. So we surveyed the 11 funded programs, and data presented in the upcoming slides is for weeks 7 and 8 of closure, and we had 10 respondents.
10 of 11. There's only 11.
Yeah, 10 of 11.
Yeah. Oh, I see that.
Oh, yeah, sorry. Like, no, and so, you know, just in terms of what sort of, what they've been able to do during this time and some of the challenges in connecting during this time, as you can imagine, you know, a lot of the time, so the majority of the programs or all of the programs said that they haven't been able to connect with some families and childcare programs because the children are no longer attending the program or the programs are closed. Sometimes folks are just non-responsive to calls and or emails, and sometimes you know, the consultants think that that's because they're overwhelmed with other issues, understandably. Another thing that has come up has been just that folks no longer need services because there are no current behavior issues. So if you know, a child is home now, then that may not be an issue, or some of the programs that the EPIC sites that have opened have had such low attendance that they haven't had major behavior issues. And you know, the issue around privacy concerns or access to technology hasn't come up as much in terms of challenges. Margot, next slide. And they've been incredibly innovative and adaptive during this time. So, you know, in addition to sort of emailing resources out to everyone, they've also provided virtual support groups for providers. At this time, there were 4 programs. Right now, there are 9 of the programs are providing support groups for childcare providers. So I hope many of you are taking advantage of those. They also are sharing resources via like Facebook and social media groups. And they also can video conference families and are doing that. And they also have started doing virtual classroom observations. And one program has a support group for families. And one thing that has come up a lot is their concern for childcare providers and the kids that are going to be returning to you. So one of the quotes from the survey participant was that she thinks that many kids have experienced trauma during this event, and we won't see the impact until children are reintegrated into childcare and school. And so they're really have been spending a lot of time thinking about how they can support, you know, you and families, you know, in preparing for reopening, and then also once you reopen, making sure that you have all the tools that you need and the support that you need. But they are expecting that there would be an increase. The other thing that has come up a lot, or one survey participant said, was that she's been in the childcare community for 40 years, and there's nothing in the past to compare the current situation to. I know childcare is going to look very different, and we will need to adjust, but it isn't going to be easy for anyone. And so, you know, with that, we wanted to sort of shift to have a discussion and really open it up to all of you to see what sort of stressors you're facing and how can we be of support, and then also how can the consultants be of support during this time.
I noticed that a couple of you were asking some questions in the Q&A, and we'll be able to answer them if you just type them in. We definitely want to get going on a conversation with hearing from you guys around like what you're worried about, not necessarily around the financing or regulatory stuff, because I know that there was a call on Thursday about some of that stuff, and there will continue to be webinars about that, but really around like your really worries, anxieties, worries about yourselves, your staff, your kids, your families. I did see one question about if you've had a long-time relationship with families, especially smaller childcare centers and family providers where families have been coming in your home for several years. How do you suddenly switch to these regulations where they say you have to drop your kid off at the door and you don't come in the building? And so what are some ways to address that with families or help kids with those transitions? And I think that's a really good question. I don't know that there's one answer. I think it's helpful if you do have a pre-existing relationship with the family, so at least you can talk through what's going to be different. But I think that question and the quotes that Laura just shared, really speaks to everybody's been through like really major transitions. And even in the most well-resourced and stable families, that can feel really traumatic for really young guys. So I think that we need to think those things through.
Yeah, something else just came up in the chat about what's an alternative to hugging a young child. And everyone in our team had a reaction to that when we read it in the regulations. Not that it's not, I think everyone is trying to give guidance based on what we know, right? But certainly, when you're caring for young kids, and so much of it is so relational, right? And you want to give them full body praise and full body comfort as needed.
Mm-hmm.
So an alternative is, getting in their eye contact, having like proximity to them as, appropriate as possible, and just connecting. A lot of it is in voice and tone. And I would also encourage you to talk about how you're not allowed to hug, right? It's going to be, that's one thing that they have still had at home, right? So even though they have had access to their classrooms, their routines, their friends, their grandparents, et cetera, they have had people that have been able to touch them, right? And so I think the more that we can sort of talk through these changes with kids,
Mm-hmm.
the better. I know a lot of people sort of feel like, well, if we explain too much, if they don't understand, that's going to get them more upset, right?
Mm-hmm.
But I think there's a lot of wise people in early childhood have said it in a couple different ways, right? But Fred Rogers would always say this as well, like you name it to tame it, right? You don't underestimate the value of just explaining something to kids, and that they might not necessarily say, oh, I totally understand in that moment, right? In fact, they won't, but they'll show you through their behavior that's sort of soothing to them.
I have heard I've read a couple things about like not saying no hugging, right? Because we really don't want kids to get the message that hugging is bad.
Mm-hmm.
Hopefully they're still being hugged at home, and hopefully this period will end and we will all be able to hug again. But talking about like sort of safe touches right now, or healthy touching right now, right? And so does that mean I pat you on the shoulder really quick, or we have a special hand signal, or there's a comfort item, that we can show each other as I know what you're feeling kind of thing. So different ways to communicate with kids where we're not inducing fear and anxiety, and we're also recognizing the feelings and what they need, which is reassurance, and that I want to comfort you as much as you want to be comforted.
Mm-hmm.
I also wanted to share that a lot of the consultation programs are coming up with social stories around these different topics. So I saw somebody ask about masks and sort of how to prepare kids for that. That's something that they've talked a lot about, and have a number of different resources that I know they would love to share with you.
And we can send out a list of resources as a follow-up to all of this conversation. I do know that the mass conversation we did have with the consultants, and they were asking for advice around, and actually sharing with each other strategies that they've used to help support staff around that. So social stories, practicing, masks on dolls, and stuffed animals and things like that as a practice, to be comfortable and safe with it.
One thing, I was part of a conversation today and somebody was suggesting like a peekaboo with a mask. And actually I wouldn't suggest, because that would make kids want to pull it down, like if it's on somebody else. And so I think it's like, how do you kind of introduce it in a way and like let them know that there's structure and rules around it? Somebody in the chat or the Q&A rather, is saying, I saw on a show about this idea of safe hugging, that kids usually only come to your thighs and you can hug without getting on their level. So that's a great solution.
That seems totally reasonable, actually.
And it's so interesting because for so many of us in this sort of place of infant mental health, like people will present these things and they want these really complicated responses that solve things, but a lot of it is really just like those very logistical, simple things are often what is more helpful. Can you share strategies on a child's fear of a provider wearing a mask? So Ruby is asking this, which is a great question. I think a lot of it is introducing the idea to them before they see you. So, even if you can on your computer or on your phone, do a really quick video of, this is still my face, but when you see me, I'm going to look like this, and send it out to families before you start, so that you look familiar, and as much as possible, sort of having the same mask so that they know you. I recently, just the other day, was out at shopping and passed somebody twice, and it wasn't until I saw her the third time that I realized it was somebody that I knew, right? Because it can be really hard when you just see somebody outside of context and it's just their eyes, and we're sort of used to also just social distancing means that we don't connect as much with people, right? And so I think just having things that make it as consistent as possible.
I'm seeing a lot of questions and concerns about, I think, just this process of re-entry with families in general, and that crosses a lot of topics, right? So if you know or have heard that the families haven't necessarily been following all the rules, what are the rules there? I don't know that there are rules, but how do you have conversations? I do think, that's a personal decision, but you could probably say we're hoping that families are practicing social distance, blah, 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 reiterating that by bringing their children into these homes, they're putting other people at risk, right? You're putting providers at risk, you're putting other kids and then the families members that they go home to at risk. So really trying to remind everyone that we're still supposed to be socially distanced, wearing masks, responsible, and things like that. I don't know how to police it per se, but I think in caring for other people is a good context.
And I think, Brene Brown talks about the idea of limit setting, right? And so I think, a lot of this is, how do we set structure and boundaries around it? And, having a rule that at drop-off masks have to be worn by parents is okay. You're actually modeling for them how to guide their kids through this.
Right. And if somebody gets sick, if a staff member gets sick or a child gets sick, you have to shut down, right? So you guys are really entering a sort of understood agreement that you're all in this together, and you want this childcare to stay open, right? So nobody wants to put other people at risk in that process. I know the other question that came up a couple times, I think Flora was asking it about having providers who are worried about coming back to work, right? If they're older or in some health risk category, or caring for people at home in a health risk category. And I feel like that's a personal staffing decision. I know that that's a hard question across childcare and across education, right? Like who's willing to even come to the workforce back, even as we're reopening.
Somebody was asking about how about the babies and how do we work with them? So my understanding from the guidance from MSDE is that the mask regulation is for kids 3 and older. So kids that are younger than 3 don't have to wear a mask. And I think a lot of it's going to look the same. It's going to look like what you used to with, physically supporting them, changing them, feeding them.
Right. It's hard not to look at a 10-month-old or a 12-month-old or an 18-month-old to not hug them or have them on your lap or engage in physical contact. So I do think it's about frequent hand washing, keeping your things sanitary, things like that.
So Teresa has an important comment here. I'll read it for the good of the group. So my anxiety, in all caps, and I thank you for your honesty, is contact tracing. Now that essential and non-essentials are back in care together, it's hard to track where parents and children have been. Some have already attended protests and other gatherings. How do I address this? I feel like I'm not in control anymore, right? So you're just sort of, there's so many different factors, right? In terms of people being in restaurants in different spaces or in community gatherings, as you said, at protests.
And I guess that's different, right, than the Epic and EPSA sites that were open when everyone was on lockdown, right?
Yeah.
So you knew the parents were really just going to work, but nowhere else. And now that's really opened up for families. So it's a whole other level of risk that you feel harder. What I hear you saying is it's harder to know. It's harder to track that down.
Yeah, and I would say, again, I think, sometimes people need clear guidance, right? And so I think it's okay for you to communicate to people that, like, this is still very fragile. You are still practicing all of these sort of safety protocols for the good of their children, right? And that you ask that, in the evenings and on the weekends, that they're so mindful of social distancing practices so that your center can stay open. Because the reality is that if there's, someone that gets sick, there's going to be the sort of the quarantine and shutdown again of different centers or different rooms, different classrooms, et cetera. And so I think sometimes people just need guidance, and it's okay to give that.
Mm-hmm.
Especially if it's going to help you feel like you have less anxiety, more of a locus of control over your center.
Yeah. I'm seeing a couple questions here also just about the young kids, right? How do you help kids under 2 with social distancing? And it's hard to keep masks on little kids. I do think for, nobody's not experienced COVID at this point, right? Like just being on quarantine and being locked down and all the transitions. And so everybody should have some idea that people wear masks. I can't, we don't really have play dates anymore. I stopped going to childcare. So it shouldn't be entirely new. I do think this is where Laura was suggesting some of the social stories would come in, so you can sort of practice it. I think in terms of keeping masks on, you guys know this because you guys are, the experts in the field caring for our little guys, but I think it's a lot about practice and repetition, right? They're not going to keep them on all day one. But just like everything else you do in your childcare centers, it's a lot of routines and practicing, right? And so repeated messages around, we keep our masks on, we don't share our masks, we don't throw our masks, right? Rewards and stickers and all the things that you normally do in your day to promote positive behaviors. Laura, you look like you were going to say
something. I was just thinking, one of the things that Chris wrote a couple times was that the one thing that has become a stressor is that he or she is planning to open back up the last week of July, and will only have 3 returning due to changes with schools and jobs, and just feeling like you're starting all over after 35 years of almost always being full with 7 to 8 children. So I'm just wondering, Kate and Margaret, do you have like recommendations on how to handle just feeling like you're starting all over? I'm just thinking like the anxiety and stress of sort of everything else that's going on, and then putting that on top.
I think the reality is, and we've talked about this before, that, for a range of reasons, so every aspect and pocket of the economy has been touched by this, right? And so some parents are not going to return to childcare because they can't afford it, or because jobs have changed, or because they're too worried, right? That their locus of control is to keep everything in if they absolutely don't have to. And so I think the reality is to adjust your expectations, right? It's not, your success this year is not going to be based on what you've done for the past 25 years, that this is going to be a wave, right? And to have, outlets and opportunities to have realistic expectations for yourself and for what this year is going to be, so that you're not putting unattainable level of stress on yourself. And, having peer connections so that that like what other peers are doing in the childcare community.
I was going to say that. I think half the battle isn't necessarily, we don't have the answers on how to solve all these problems, right? But some of it is like naming it, right? Like giving you the opportunity to put it out there and share it with your peers, figure out if your peers have figured out something you haven't. And how do we figure out how to manage some of those stressors? So we can't control COVID. Like, none of us have had any real control over our jobs or our kids or school or childcare during this time. So how do we know who can help us? How do we know how to take care of ourselves and manage our own stress? Who do we reach out to? Like, who's your community? And how do you help others through it? Right? So I think that's right. Like, figure out what other folks are doing. You know, I think COVID looks different. You know, best practice looks different in COVID. How we manage our jobs and our kids and our families looks very different in COVID. So I think it's about being adaptable. I would also say probably as much as like your families aren't returning, there are probably other childcares who didn't reopen and other families will need slots. And so there may be some adjustment and realignment over time.
And I mean, the early childhood people are, you know, inherently adaptive, right? You have a plan for the day, and I mean, you adapt your structure, your plan 3 times because that's what the short people in front of you need, right? And so, I think to Margot's point, I think it might be outreach to different people, right? Or you might, you know, and also, like, I mean, who knows what's going to happen with the plan for the new school year in terms of what that structure is going to be. So you might, you know, not be this, like, the center full of, you know, 7 to 8 28-month-olds, right? But it might be more like aftercare and sort of combined age and that kind of thing too. So I think trying to be adaptable as much as possible right now.
Mm-hmm. So Sarah was asking about if you have somebody with underlying conditions but they want to come to work, could they do it if they're not doing direct content? Like, could they clean or prep things or manage entry and exit, but like without coming in contact with the kids? So I think that's probably about your space, and if you think that's manageable and if they can be socially distant enough, and that's a helpful service. I don't see why not. And then another question was like, just to clarify about kids, it's really 3 and up need to have masks. So ages 2, you know, until they turn 3 and younger don't need masks, but really wearing them all day. So if a child's in childcare for 10 hours, I'm not the person who makes the laws. That's obviously, I would imagine they're like, when they're eating and when they're sleeping, you're not wearing masks, right? So not during nap time. But I think that's about like making sure that there's distance from their peers during those times.
Mm-hmm.
Which others can chime in on that.
Yeah, no, that's what I've seen discussed. If a 3-year-old was a biter, how a teacher has to deal with this child. So, I mean, biting is pretty common for kids that age.
Normal. Mm-hmm.
Yeah. So I think part of it is knowing that it's, you know, and again, like as we're preaching to the choir here, you guys know this, but that there's a range of typical within this developmental time period, right? So I think, you know, first, like measuring it, right? You know, has this increased? If you're thinking about biting in terms of just safety, in terms of exposure from COVID, I think things like keeping masks on is helpful, and just giving them alternatives to biting. So talking about it, you know, we don't bite, we can do something else. There's great books, Teeth Are Not for Biting, Hands Are Not for Hitting. Mm-hmm. Tails are not for pulling if you have any animals in your home while you're caring for young kids. But again, it's just repetition and language and alternatives.
I would also say, like, if you know the kid's a biter, right, the best strategy is to prevent it from happening. So then, and they often recommend like close proximity, so that you know as soon as a kid is going to get triggered or leans in, you just like move them away so they don't have the opportunity to have that behavior, because the reaction to the biting is often very reinforcing. Kids get big reactions. They're negative, but big reactions that are reinforcing. So sometimes it's about just trying to be there, like have a close adult buddy for the couple days to like diminish the behavior.
Somebody was.
Yeah.
These questions keep getting skipped, and so I'm looking for the question. Oh, in the event that a consultant is requested, are parents informed ahead of time or not? I believe that
they have to consent.
Yes, so consent is required. One of the things that consultation programs are discussing right now is having a sort of standard form that you could have folks fill out. I'm not sure if you're thinking about like in terms of like virtual observation or just actually engaging in consultation at all. I wasn't sure.
So I think let's clarify like on what consultation can look like. Because sort of nationally in our state, there's sort of different levels of consultation. So you can have a child specific, a classroom specific, or a program specific. And so a child specific is, you know, I have a biter, I need some help, can you come in? A classroom specific is, I'm not really sure, I have a couple kids that are challenging, or this group seems to be more challenging, or I'm a new teacher, or I'm in a new building and I just like want some help. And that person would come in and really work on like, what are your classroom rules, routines, like visual schedule, spacing, do you have a quiet corner? You know, just basic strategies, a little bit more than TA, and really focus specifically on social emotional things. So talking about, you know, using social stories to talk about feelings and things like that, promoting positive peer interactions. And then program consultation is like the same, but like program wide. So we certainly could have, you know, you can engage consultation at a program level or a classroom level that doesn't require the parent to be involved. The parent consents when it's a child-specific case, if that's helpful.
I'm just seeing a really great question from Josephine. As family childcare is a mixed group, if if you have a 2-year-old, how are you going to handle some kids being required to wear a mask and others not?
Right. That is a good question.
Hard.
And I imagine it would happen even in a childcare center because some kids would see the other kids in other classes, right? Like, why does our class, why do the 3s wear them, but the 2s don't? So I think that's about roles and practice. Being a big kid, being a little kid. I don't really have a good answer for that one. That is hard.
Yeah, it is. It's sort of like the almost like the big sibling discussion, right? Of like, you know, older kids need this because you are able to be more mobile. You're able to, you know, it's sort of almost like it's not a punishment, it's a right, right? It's something you earn by being a year older, and this is what and this is what comes with it, right? So because we wear masks, we're able to be, you know, in centers closer together. We're able to you know, do more X, Y, Z. And you know, I imagine this is all going to be evolving as we go through different sort of phases, and there's different guidelines from the state at different times.
So I also just wanted to point out, I think what I'm hearing is a lot of anxiety about how do I communicate with my parents about, you know, the new guidelines, or how do I talk to them about their behaviors outside of here. And at the end of the day, we're really talking about relationships and communication, right? Yeah. And nothing works super well if it's like not punitive, right? Like if you don't want it to be stressful, intense between you and families, but you do want it to be like an open dialogue and communication. So I'm also seeing other people say like, you know, utilize the good relationships that you've built to say, you know, I do have to have boundaries. I do have to be clear about what's happening. It's really about having, I think, adult relationships, you know, more than the kids, right? So I think that's what's been really hard about COVID is like, people are like, oh, I'm used to working with the kids. And this is really a lot more working with the adults than maybe intended originally. And
to that end, I think, you know, we just want to spend the last 6 or 7 or 8 minutes or so really focusing on, you know, you guys and your stresses. So, because you've all sort of answered the, you know, more cognitive stuff about, you know, you and your roles and what gives you anxiety about that. But what are you guys needing or experiencing right now in terms of supports for you?
And just as a reminder, on Wednesday, the conversations are going to be what are the lessons learned. So I think that's a really good chance to sit here. What have the people who have been open this whole time done? What's been effective? What are some tricks of the trade at this point? So some of those questions will hopefully get answered. We do want to make sure we're hearing from you about like, what do you need to care for yourself and for your staff, you know? So is it helpful to have the consultation sites do those support groups? I know some of them are doing mindful moments and meditation. Some of them are doing circle of security parenting groups. Huh?
No, one is doing like making calming putty and doing all these like yourself activities, which is really neat.
Yeah. You know, and we don't really have any power over the regulations, but certainly in partnership with MFN and MSTE, we're always sharing what we're hearing from the field, so we'll continue to do that. So yeah, but we just want to also hear what else you guys need.
The masks are something that just keeps.
It's hard, right?
Well, and I'm just wondering, like, you know, we talk a lot about the anxiety of parent, like, you know, or I think Kate talked at the beginning about sort of it being about the adults in the kids' lives, and how do we manage our own stress and anxiety about keeping the masks on, or if that's all we're focused on.
Right.
How does that impact the kids, and sort of how do we, you know, I don't know, take care of them? Or,
and someone is saying, like, even if a parent says, I don't care, you don't have to make my kid wear a mask, right? You still have to follow the regulations about making kids wear masks. So it's tricky. It sounds like a lot of stress is just in following the regulations, as well as worrying about the health risks. It's, you know, keeping you and yourself, your staff safe, as well as getting parents on board with all of the strategies. I know we didn't necessarily answer the entry one, right? How do I get parents not to come in the building? I think that is a really hard one, right? Because it changes the nature of your whole entire business to be like, just drop them at the door or hand me your baby.
Well, and
just
the relational nature of sort of check-ins and information shared and, you know, relationship building that happens in those, you know, couple of moments each.
Yeah. I don't know, again, this may come up on Wednesday. It seems sometimes the best way to reduce stress is to prepare, right? Is to be over-prepared. And as Kate was saying, name it, right? So it might be helpful to have all of these like questions like typed up or sent, like make a little video of like, I know you're worried about this, but this is my plan. Or I know you've asked about this, but like, these are the regulations, or just a way to communicate with your families ahead of time, so they know what they're walking into.
One person shared that yoga was helpful to them in terms of, you know, reducing stress or just managing. And I mean, we often in many of the sort of trainings and coaching and support that we give to systems and providers talk about sort of self-care, and not in a tongue-in-cheek way or like all right, this is the last part of the lecture, we're gonna end it here, but really about like, I mean, it's so important, because if for you guys to be able to manage, you know, kids typically in this, you know, a room full of 2-year-olds typically, I mean, you guys are saints. And it takes a great deal of reserve and connection and energy and all those things. And now I think, you know, we can't underestimate just the degree to which everyone has been stretched, and that you're gonna, you know, be working within, you know, a setting that was, you know, might be your typical setting, but that, like, you know, kids are going to come in with a range of different, I mean, even just, you know, re-exposing them to a routine where they may have gotten totally off track because parents are focused on survival right now, from, you know, sleep hygiene, from getting up on a regular, you know, at an appropriate time, from, you know, socialization practices. So just know that it's going to be a big lift. And that, so having either people to check in with or strategies to take care of yourself is not underestimated.
Any other last parting thoughts or questions?
Margaret, do you just want to put up this slide with our...
Yep. Yeah. So this is, you can reach us here. It's the general Peak email, but we see them all. They come directly to all three of us. And then we will follow up with, we'll make sure everybody has the names of the programs and the contact information for each of the early childhood mental health consultation programs in your jurisdictions. The one thing we didn't mention is that a few of them also are running warm lines. So you can, not everyone, you know, every program sort of responds to the needs in their local community, but a couple of them have already had or started in COVID some warm line where you could just call with general questions and concerns. And again, it doesn't have to be necessarily child-related concerns. It can be program, classroom, provider-centric concerns. But we'll make sure you have all the information to access all of those. And we'll compile, the summary of all of this for you and put together the resources that seemed most relevant for the questions that came up.
And to clarify, because it came up early in the chat, but or the Q&A, the service is free to providers, childcare providers, and families. It's paid for by Department of Education.
Yes. I see you guys responding to each other's questions, so that's really helpful. So you guys are resources to each other, really.
No, and that's one of the reasons that I encourage everybody to take advantage of the sometimes they're the weekly or biweekly support groups that the consultation programs are holding. And we'll share the information, but definitely take advantage, because they're also super flexible and trying to figure out how to best support you all during this time. And so please reach out to them or share with us what would be helpful.
Okay, any other pressing last minute items that we did not respond to?
No.
I think we're good.
Thank you guys so much for a fantastic conversation, and thanks to everybody who joined us tonight. We had almost 100 people very consistently on the line for the whole discussion. I hope that some of you, all of you, will join us again on Wednesday for our next discussion about lessons learned from EPIC providers. Again, childcare centers at 4:30 and family providers at 7. Thanks, everybody. Could not do this work without you.
And Doug is saying you can continue the conversation with each other on Facebook, on the MFN Facebook page.
That's true. Never forget to plug the social media. Thanks, everybody.
Thank you.
Thank you so much.